I was pretty scared. Being a new grad out of school, I had just graduated in December and started my job here in January. So literally out of school, and here comes COVID. So it was a learning experience for me, and all of my coworkers at the same time. I mean, nobody knew what was going on, so we were all kind of like, this is scary. I think we've gotten more comfortable, as far as treating the patients and, donning and doffing our PPE. That was a big thing. Everybody kind of had to relearn how to do. You learn it in school, and then you kind of forget because you don't have to, do that on a daily basis. And now we just it's kind of natural. We just throw it on, throw it off, and it's just become easier, more of the normal. Every day, come to work and just do what we have to do. It's changed a lot, but mainly because I'm now working in the medical field where I wasn't before. I was in school for a long time. It's been stressful here at work, but then I get to go home to my family and they're all healthy and they're happy, and I might see something, sad at work, and I go home to my family and they're there, so it just, makes everything better. My first COVID patient that I had to have intubated, I don't want to cry though, but I'm going to. He was so scared. I remember him getting on the phone. I had him 3 days prior to that. He was getting worse and worse every day that I saw him, and the doctor came in and said, we're going to have to intubate you. And it's like he knew he wasn't going to make it, and he got on the phone with his family and he talked to his family all before, and then we took him down, and I just remember we all just squalled. We just cried and cried because we just knew, this was hard, and he was so scared, and I've never seen anybody just decompensate that fast and just know what's going on, and he knew, and he didn't make it. It was a few days, and I'll never forget him. I know his name. I remember his face. But that's probably the most, heartfelt thing I'm going to remember. Oh, the team's been phenomenal. I mean, my fellow coworkers as a respiratory therapy team, we help each other. It's been great. I wouldn't want to have worked anywhere else during all of this. I feel like we've really come together. We're a family. And the nurses on the floors, the nurses in the ICUs, we're all a family. We're all a big family. I always saw some hope. The types of people that got really bad off with COVID, the ones that got really sick and ultimately didn't make it, you never knew who that was going to be. They were going to be 28 years old, or they were going to be 93 years old. We sent home a 93-year-old man on oxygen. It was like, I always had hope because you just didn't know, if it was an old person that came in, it wasn't like, oh, they're old, they're going to pass away, So it's like we kind of never really figured out the whole, like, what makes it bad for some people and not bad for others. But I feel like not intubating them right off the bat and letting their bodies kind of work back to what they needed to be really gave me hope that there's a way out, even for some that get really sick.